Welcome everyone, and thank you so much for joining us today for our NAMI StigmaFree Chat. We are going to be talking about a lot today. First, a brief intro for myself. I am Meg Delp, the Director of Workplace Mental Health for NAMI National. I oversee our Stigma-Free Workplace initiative, where we partner with companies to bring mental health to their employees, managers, and leadership. Today, I am joined by one of our long, amazing standing partners, The Hartford. Anabel, thank you for joining us today. Handing it over to you for an intro.
Thank you so much, Meg. Hello, everyone. I'm honored to be here today. And before I dive into my role, I just wanted to take a second to express how meaningful I think this partnership is with NAMI. The work that you all are doing, raising awareness, impacting the stigma around mental illness, supporting people is so important and something that we at the Hartford truly value. So thank you. In terms of my role, I am a licensed clinical social worker by training. I have a little over 28 years experience in the mental health field. I'm a clinical manager here at the Hartford. I lead our behavioral health unit, so my team supports individuals covered under our disability and workers' comp benefits, many of whom are navigating really complex mental health challenges during some of the most difficult moments in their lives. So my why, or what motivates me most, I think, is bringing my clinical perspective into the workplace, helping organizations, employees, U.S. workers better understand mental illness, mental health, ways that we can reduce that stigma that can be such a barrier for people getting the right level of care. I think my goal is to create environments where people feel seen, where they feel supported, where they feel safe enough to ask for help. So again, that's why I think our partnership with NAMI, especially the Stigma-Free Workplace initiative, is so important. I think the work is a place of, or can be a place of connection and purpose, but it can also be a place where people feel pressure to hide what they're going through. So I think together we're working on changing that. So I'm looking forward to the conversation today.
Absolutely, yes. And, as a fellow therapist, I appreciate the work you do for the Hartford
Thank you.
so much, and also very much appreciate our partnership. You and I even have known each other for quite a few years now through this partnership and have gotten to work together. So our work could not be possible without the amazing partners that we have, like the Hartford. So all the gratitude.
Thank
Um,
you.
Looking a little bit at our data, our workplace mental health data, NAMI, we do a workplace mental health poll every single year. And this year, we found that fear of stigma was still unfortunately quite high. And that is what kept many people from sharing about their mental health. About 48% reported worrying that they would be judged for sharing their mental health struggles with coworkers. And on the flip side of that, 80% said that they would feel comfortable if a colleague came to them with a mental health concern. So we know that people are willing to engage in these conversations. They want to support one another, but there's still that gap between feeling okay to actually talk about it themselves. And so we've been working with y'all at the Hartford to really start creating resources to open up that conversation, decrease stigma, dive into this space a little bit to make that gap much smaller. And I know y'all have some great research too. I'm wondering if you would want to share some of that.
Yeah, absolutely. So over the last several years, we've ran some studies where we poll U.S. workers and U.S. employers. And over the last few years, especially in our 2026 study, the Hartford's research has made it clear that mental health remains a critical issue in the workplace, right? So employees are increasingly turning to their employers for support. But as you said, there's still a gap between what's needed and what's consistently, I think, available. I think the majority of employees still say that they want more mental health resources. We're also seeing that mental health challenges aren't affecting populations equally, right? Like, yes, across all the generations, we see that people are experiencing mental health events, if you will, right? But the newest generation to enter the workforce, so the Gen Z population, they report higher levels of anxiety, higher levels of depression, and significant barriers like, the stigma that we talk about and getting in the way of care. So we know that mental health impacts the bottom line for companies, right? So it impacts things like productivity, engagement, even safety in certain scenarios. So I think on the positive side, we're also seeing a shift where organizations are beginning to think about mental health as part of the whole person being or well-being, right? Not just a separate issue. I think our research highlights the growing need for that personalized support too. So, resources that are tailored to meet employees where they are. So I think that's what makes conversations like the ones that we're having today so important, because we're looking to see what we can make easier for people to ask for help and get the care that they need when they need it.
Absolutely. Yeah. And it's so important to look at the industry you're in, your employee population, how many caregivers you have. Do you have employees that are mostly in urban settings or rural
Right.
settings? Those benefits, those resources need to look different depending on where your employees are. So, yeah, really understanding who is at your company is 100% step number one.
Mhm.
And so diving into more of what the Hartford is doing specifically, I mean, throughout our entire partnership, it is so clear that y'all are really leading the charge on workplace mental health. You do research, you have your own partners that you work with in this space. Um, what is it that keeps this topic really at the forefront for you at the Hartford? And I'm curious kind of how you've seen it evolve over the past
Yeah.
couple of years.
Yeah, yeah. I think what keeps the topic at the forefront for me is the people behind the work, right? So I'm a clinician first, and through the work that I do at the Hartford, I've come to understand how much work can be a great resource for, as I said before, connection, for purpose, but it can also be a place where people can feel pressure to push through or hide what they're going through. And that reality is what keeps it important for me. I think over the years, I've seen a meaningful shift. There's more awareness now, there's more willingness to engage in these conversations. And I think organizations in general, including the Hartford and our CEO, Chris Swift, who is really intentional about how we support mental health, and not just in moments of crisis, but across the entire employee experience. I feel like more and more employers are thinking about things like prevention, early intervention, how to design benefits and resources that meet people where they are. So I think partnerships like the one we have with you, with NAMI, have been part of that evolution, right? So they help keep us, I think, grounded in real experiences that individuals are going through, that US workers are going through, and things like employee resource groups, for example, right, that are fairly new to the scene, right? So maybe 30, 40 years ago, we didn't have employee resource groups, but I feel like this has given people a unique opportunity to find community at work. And it's that social connection piece that I think is possible when you find a group of like-minded people, right? And we have talked about this, Meg, you and I, right? We spend so much time at work, and for many people, work is the only place of social connection. So having these different resources, these different opportunities for community at work is where I think I'm seeing the biggest progress happening.
For sure. Yeah. And you mentioned the awareness building, also your own leadership, really kind of walking the walk. We know that awareness is for sure the foundation, but unless we're seeing action, unless we're seeing that mental health story lived out from our managers, our leadership, it's hard to trust that it's real. And so taking that awareness and moving it into real practical actions, that is so key to start building that trust that I actually can use the mental health benefits. I actually can ask for support. And so it really goes such a long way to see leadership so engaged in the mental health conversation. We know that benefit usage is low, especially for things like EAPs. In our own study, we found that awareness of the benefits themselves is very low. And so just bringing this conversation up, talking about it openly, making sure that we are aware of what we have access to so that if someone does come to us, we can say, hey, did you know we have access to an employee assistance program? Or we have a local NAMI affiliate that I can help you get connected to really start that conversation, find the help that you might need. Moving into that place of action and really understanding how to support your fellow colleague, it does move us into that prevention space. And so that's where we really start to see folks feeling safer, building that stronger community at work, and that is just invaluable. We have worked together on quite a few resources, one of which is our Workplace Mental Health Crisis Guide. This crisis guide is specifically for guiding someone through, my colleague is experiencing mental health crisis at work, what do I do? The intention of the crisis guide is to make sure that that person is cared for without stigma. We have follow-up guides. What do you do after? How do you communicate? How do you maintain confidentiality? We really tried to cover the whole gambit. And there's also a quick guide to make sure that you have all the information you need going into a crisis. So this crisis guide is definitely something that you want to investigate. If you're on, we're going to drop the link in the chat. Investigate before you need it so that you have your steps ready to go. Many folks have crisis guides that cover things like weather or like the more external crises that you have to help your employees get to safety. This one is specifically for helping an employee experiencing a mental health crisis, which is a very unique situation, and so you want to be prepared. In looking at these resources that we've created, we are also trying to tailor resources to specific industries. Any thoughts from your side on our amazing crisis guide or our new guides for specific industries in construction, manufacturing, and education?
Yeah, so starting with the crisis guide, I have shared that resource so many times already. And I think something you said is so important, which is you don't want to familiarize yourself with a resource like that, which is really comprehensive, by the way. It has like a quick view that you can, look at and figure out what you need more information on. But you don't want to utilize a resource like that in that moment of crisis, right? So making sure that you're familiarized with it ahead of time, and having leaders, and I've said this before too, like leaders don't have to become therapists, right? They just have to be comfortable having the conversation. They have to be comfortable having those resources so that when things do happen at work, which unfortunately and inevitably they will, right, that they are ready and equipped to deal with it. And I think this guide is a great way of doing that, and getting people prepared to deal with it. I think in terms of the more like the more tailored resources that you just mentioned, right, for the construction, manufacturing, and education, I think I love these resources. I think mental health at work is not a one size fits all, right? Like the experience of employees, the barriers that they face, they're going to look different depending on what industry they work in, right? So different industries have different work environments, they have different stressors, they have different cultural norms. And I think those factors, they shape how mental health challenges show up for each individual employee. It impacts whether people feel safe speaking up or even asking a question. It impacts how likely they are to seek support, right? So I think approaching every workforce in the same way, I think we risk missing what people actually need. And tailoring the resources helps them feel more relevant. It makes things feel more accessible and hopefully more real, right? So just to touch upon some of these industries, right? So when I think about the construction industry, and even in my experience working mental health claims, right? One of the highest risk industries, I think, is the construction industry from a mental health perspective. I think, there are higher rates of certain scenarios like suicide that occur. This is an industry where you see people working long hours or working overtime, or it being a physically demanding job or a high risk job. Some have seasonal employment, or they suffer, a comorbid conditions where there might be that, right, like that mental illness present, but also chronic pain or injuries. And the culture too, I think, is one of, maybe pushing through a little bit more, and less about asking for help, which can be really, really isolating. The manufacturing industry, we see a lot of like repetitive movements, right? Again, that physical demand is there. The stigma is pretty high as well. So the resources may be there, but the utilization might be lower. And then education, right? With, our teachers, I think it's less physically risky, but there's more of an emotional toll or emotional labor, right? So teachers are looking at academic needs, but they're also present for behavioral and emotional needs. And I think it's a culture of almost like self-sacrifice, right? Because the students come first, those families come first. So they push through for the kids. And I know some of what we've seen in claims is they almost feel guilty for taking time away to heal, right? So there's a hesitation, I think, to prioritize their own mental health. So I think all of these differences are very important considerations, and having resources that are specific to that industry makes all the difference, just like the crisis guide.
Absolutely. Yeah. And when we were building these resources, the Hartford provided so much insight into these industries, what kinds of resources would make the most impact, where we should focus. And then obviously we brought the mental health knowledge, and together we got some great resources to share. So definitely check them out. We're going to drop those links in the chat as well. We'll probably be making resources for more industries in the future, but for now we have our construction, manufacturing, and education resources done with the Hartford. Definitely check them out. We do see those unique stressors, like you said. It is so different industry by industry. I know for healthcare workers, there is that same feeling of, I can't take time off for myself. I have patients to see, I have clients that are relying on me. And for many frontline workers, it has that same feeling of guilt and
Yeah.
being dependent on. And we see that in uh, so many industries where folks just feel like they can't step away,
Right.
that they're going to let down their teams or their colleagues are depending on them. And so that pressure to always show up,
Right.
it just is, you know, a straight walk to burnout.
Mm-hmm.
And so
Absolutely.
really understanding how we can start those conversations, like we've been saying, that prevention space of, I'm starting to feel overwhelmed.
Right.
How do I have a conversation with my manager to make sure that we can look at workload, look at how the team is functioning together, our communication standards, our boundaries, all of that stuff, so that we don't actually get to burnout at all. And instead, it's managing the stress before it gets overwhelming. I'm curious, when you think of workplace mental health, you've been in this space a long time. There are obviously trends that we see, both positive and negative. With our increasing awareness of workplace mental health, impacts on stigma, which at the moment we see some increasing stigma in some areas, some decreasing stigma. It's a little all over the place there, but in general, we're
Mm-hmm.
seeing some positive trends. Um, I'm curious, what is the most encouraging trend or trends that you're seeing right now?
Yeah, and I think you touched upon it. I think it's the increase in awareness to me is the biggest one. It's having, I think, a real impact on the stigma. I think the more that we normalize conversations around mental health and recognize it as a core part of our well-being, right? It's not a separate issue. It's part of our holistic well-being. The more we create psychological safety in settings like the workplace, when that safety is there, I feel that people start to feel like they have permission to show up as their full selves, not just part of themselves. And you know, I think creating that kind of environment, and you've heard me say this before, starts at the top, right? So I mentioned Chris Swift earlier, but at the Hartford, we are really fortunate to have strong leadership in this space. And Chris has very open dialogue and conversations about mental health and has supported meaningful partnerships, one of them being with NAMI. And I feel like that sets the tone and makes it easier for leaders across our organization to lean into those conversations. And I think the key is that leaders, like I said, you don't have to be an expert in mental health, but just be willing to engage, be willing to listen and be curious about how can you create those spaces and feel help your employees feel supported and comfortable asking for help. So to me that's the biggest one. And we see it in our own claims where we're seeing people of all ages, right, that are putting forth or going out on claim because they need it. They've reached that point where either it's not quite at that stage of depression or anxiety, but they're already struggling and they're seeking help. And we see it across the genders as well, which I think has been another positive trend, right, where I think historically there's been a lot of stigma around men's mental health where we're seeing, men and women both and different generations raising their hands and saying, I need help, I need support. And I think, for people like you and I that have been in this industry a long time, it's great to see that change and that trend happening.
Absolutely. Yeah. When you start seeing the folks who typically are anti-mental health for whatever reason, whether that's internalized stigma, peer pressure, just not having the awareness, not growing up with mental health education.
Right.
When you see those folks really start reaching out, taking care of their mental health, understanding that they deserve to take care of their mental health, that is such a beautiful thing and really does point to the success of the company raising awareness around those mental health benefits. I mean, when I was talking with a Gen Z person a little while ago, and she had no idea that she could use short term disability for mental health. And so, even making sure that we are communicating to all employees all the time throughout the year, not just at open enrollment, not just at new hire
Right.
orientation, that these benefits exist not just for physical health, but also for mental health, it can go such a long way in folks actually feeling safe to use them, having the knowledge that they can use them, just
Right.
really increasing that benefit utilization and hopefully really, we'll say it again, looking at prevention. We want
Right.
to start really helping folks before they're
Right.
really in crisis mode. And
That's
so
right.
that awareness building is just absolutely crucial.
Yeah.
One additional question. So we've looked at trends up to now.
Yeah.
I'm wondering what you're hoping to see for the next 5 years, 10 years, whatever time frame. What are you hoping to see?
Yeah. I think, you know, 3, 5 years from now, I hope mental health is fully embedded into our organizations. Not something, like I said earlier, not something separate or reactive, but something that is part of how work gets done every day, right? I think also, and based on our conversation today, we move towards something that's more personalized as well, right? Recognizing that people in different industries have different needs, different experiences, and they may need different support, right? I hope
Mhm.
that employees feel that they matter, that they feel supported, not just for what they produce, but for who they are as people. I think frontline workers, shift workers, those in high demand industries where access to support can still be quite challenging. I think focusing on individuals where needs may be less visible. I was recently at NAMI Con. We talked about people who identify as neurodivergent, right? So that's a great example. People navigating neurodivergence in the workplace, people who have caregiving responsibilities, people that are in midlife transitions, right? Like those things that may be less visible to others, making sure that we're focused on understanding all of that. So I think we need to continue our focus, like I said, on tailoring those supports that feel accessible but also relevant to diverse populations. So going back to what I said earlier, right, moving away from an approach that may be more one size fits all, right? And something that you said, Meg, is something that I also try to keep in mind even for myself, right? Like we have this time every year during open enrollment where we talk about our benefits, but it really is so important for leaders to continue that conversation throughout the year, making sure that people understand what that whole package of benefits, what they are, but what is it for mental health specifically, right? Like, are there apps? Are there things that people can do from that preventative lens to take care of themselves throughout the year? So, yeah, so that's my hope, is that we're in a far better place from a stigma perspective, awareness perspective, and resources perspective.
Absolutely. Well, I know our partnership will keep chugging along, hitting those goals.
That's
So
right.
we will
That's right.
definitely keep moving in that direction. Um, we are at time, unfortunately. I am so, so grateful for your time, though, and it has been a delight talking to you as always.
Likewise.
Um,
Likewise.
We are incredibly grateful for our partnership with The Hartford. Y'all provide such a beautiful balance with our subject matter expertise, and it really works out so beautifully. And I'd like to remind everyone that we have our training You Can Ask, supported of course by The Hartford. This training can really help kind of get that ball rolling, teaching folks how to really start that conversation, how to have it safely in the workplace, and then how to help your fellow colleagues get connected to the right resources. Like you mentioned, Anabel, we don't want anyone to feel like they have to be a therapist or a mental health professional at work. We are all too busy to add another hat. And so understanding how to connect your colleagues with their benefits, their local NAMI affiliate, it can be so, so helpful. And this training is available publicly online. Again, we'll drop that link in the chat. But please continue to learn more. We are all in this together, learning how to bring workplace mental health to the forefront, moving into that prevention space, and just really trying to figure it out together. And if you have any questions about any of it, please reach out to us at Stigma Free Workplace. Our email is stigmafree@nami.org, and it will likely be me or one of my teammates answering. So please do reach out if you have any questions or if you're curious about becoming a stigma-free partner. And again, Anabel, thank you so much.
Thanks, Meg. Thanks for having me.
Absolutely.